Hello, my dear friends. I want you to take a deep breath with me for just a moment. What I'm about to share with you today might be difficult to hear, but it comes from a place of love and genuine concern for you. If you're over 60, or if you're caring for someone who is, I need you to listen carefully to every word. After speaking with hundreds of healthcare workers, patients, and families over the past year, I've discovered something that's been weighing heavily on my heart. There are 5 harsh realities about how our medical system treats older adults, truths that are affecting the quality of care you receive, the respect you deserve, and possibly even your life expectancy. But here's why I'm sharing this with you today. Knowledge is your greatest protection. Once you understand what's really happening behind those examination room doors, you'll have the power to change everything about your healthcare experience. One retired nurse, Sarah, told me through tears, "If seniors knew what I know about how they're really viewed in hospitals, they would never walk into another appointment unprepared again. So please, stay with me for the next 36 minutes. What you learn today could literally save your life or the life of someone you love. And if you find value in what we discuss, I'd be grateful if you'd hit that subscribe button, because together, we're going to change how seniors are treated in healthcare." Let me tell you about a 72-year-old retired teacher from Ohio. She walked into her doctor's office last month for what she thought would be a routine checkup, but before she even sat down, something had already been decided about her care, something that would affect every moment of that appointment. You see, the moment your age appears on that medical chart, a mental calculation begins in your doctor's mind. It's not personal and it's rarely malicious, but it happens every single time. Healthcare professionals are trained to assess what they call resource intensity. The moment they see you're over 65, you're automatically placed into what they consider the high-maintenance category. They assume you'll need longer appointments, more tests, more complicated treatment plans, and more hand-holding through the process. Doctor, a family physician who's been practicing for 15 years, admitted to me in confidence, "We're taught efficiency protocols in medical school. When I see an elderly patient on my schedule, I automatically know that appointment will run long. It's not fair, but it's how we're trained to think." Now, here's where this gets particularly troubling, and I want you to understand this clearly. Your doctor is under enormous financial pressure. With insurance reimbursements declining and patient quotas increasing, every minute of their day is calculated down to the dollar. When they see your age, they're not just thinking about your health, they're unconsciously calculating the cost of treating you. And that creates a subtle resentment that can absolutely affect the quality of care you receive. Recent studies have shown that doctors spend approximately 23% less time actively listening to patients over 65 compared to younger patients with identical symptoms. 23%. That's nearly a quarter less attention to your concerns. Let me share a story with you. She had prepared a detailed list of symptoms she'd been tracking for 3 weeks: fatigue, chest discomfort, and difficulty sleeping. But the moment she began to explain, her doctor interrupted. "Let's focus on your main concern today. We need to keep this appointment on track." When she tried to explain that all her symptoms seemed connected, the physician sighed audibly and said, "We need to prioritize here." Her chest discomfort was quickly dismissed as anxiety, which delayed a proper cardiac diagnosis by 4 months. This brings me to what medical professionals call complexity aversion. Doctors often avoid ordering comprehensive tests for seniors because they assume the results will reveal multiple issues requiring extensive treatment plans. They'd rather treat surface symptoms than risk uncovering systemic problems that take time to address properly. Think about that for a moment. Your doctor might be avoiding tests that could save your life simply because they're afraid of what they might find and how long it will take to treat. Before we continue, if you're recognizing these patterns in your own healthcare experiences, please take a moment to subscribe to our channel and ring that notification bell. We're building a community of informed seniors and caregivers who refuse to accept substandard care. Your subscription helps us reach more people who need this vital information. Now, here's how you can immediately combat this bias. and I want you to take notes. 1. Start with specific, measurable goals instead of saying, "I feel tired lately." Try this approach. "My energy levels have decreased by about 40% over the past 2 months. I used to walk 2 miles every morning, and now I'm struggling to walk around the block." I want to identify what's causing this specific change. This transforms you from a complicated senior into a goal-oriented patient in their mind. 2. Bring a one-page health summary. Create a simple, concise summary that highlights improvements you've made through previous treatments. Show them you're an active participant in your healthcare, not just a passive recipient. Doctors respond much more positively to patients they see as partners rather than problems. 3. Request specific time frames. Try saying something like, "Doctor, I understand we have limited time today. Can we schedule a 30-minute appointment next week to thoroughly discuss my cardiovascular concerns?" This shows respect for their schedule while advocating for appropriate care. 4. Document everything. Bring a notebook and take notes during your appointment. When doctors see you paying attention and recording details, they realize you'll remember what was discussed. This accountability genuinely changes their behavior and communication style. Now, let me tell you about something that breaks my heart every time I hear about it. It's what I call medical gaslighting, and it's become so common in senior healthcare that many doctors don't even realize they're doing it. When doctors attribute your legitimate symptoms to normal aging, they're using a socially acceptable form of discrimination that delays proper diagnosis and treatment. And the statistics are absolutely alarming. The American Geriatric Society found that 85% of serious conditions in seniors are initially dismissed as normal aging before receiving proper diagnosis. Let that sink in. 85%. That means heart disease gets labeled as fatigue from getting older. Thyroid disorders become normal energy decline. Depression is dismissed as adjustment to aging. And cancer symptoms are brushed off as just wear and tear. Let me tell you about Carl, a 67-year-old former construction supervisor. For 8 long months, he complained to his family doctor about increasing joint stiffness and overwhelming fatigue. Every visit resulted in the same dismissive response. "Carl, you're not 30 anymore. Your body is naturally slowing down." But Carl knew his body. He'd worked construction for 40 years. He understood the difference between normal tiredness and something being genuinely wrong. When he finally demanded blood work, and I mean he had to demand it, they discovered severe rheumatoid arthritis that had been causing permanent joint damage during those 8 dismissed months. How many months of pain and damage could have been prevented if Carl's doctor had taken his symptoms seriously from the beginning? Medical gaslighting follows very predictable patterns, and I want you to recognize them. Doctors use phrases like, "At your age, that's expected," or "We all slow down as we get older." They redirect conversations away from investigating symptoms. They recommend generic solutions, more exercise, better sleep, stress reduction, without determining why these issues developed suddenly. Women face double discrimination, with symptoms dismissed as both aging and hormonal changes. Men's complaints about sexual health or emotional changes are brushed off as normal male aging. Mental health concerns receive particularly dangerous treatment, with depression and anxiety attributed to life stage transitions. Perhaps the most insidious aspect of this gaslighting is how it makes you doubt your own experiences. When authority figures repeatedly tell you that concerning symptoms are normal, you begin questioning your own judgment. This self-doubt delays help seeking and worsens outcomes. I've spoken with countless seniors who told me, "I started thinking maybe I was just being dramatic," or "I thought maybe I was imagining things." No, you know your body better than anyone else. Here's exactly how to respond to age-based dismissals. 1. Ask for evidence. When a doctor says that's normal for your age, respond with, "What percentage of people my age experience this exact symptom? What studies support that this level of symptoms is typical?" Most doctors can't provide evidence because they're making assumptions, not medical assessments. 2. Create symptom timelines. Instead of saying, "I'm more tired lately," present data. My energy levels were stable until March 15th when I began requiring afternoon naps for the first time in my adult life. This represents a sudden change, not gradual aging. 3. Use the comparison question asked directly. What tests would you order if I were 40 with these same symptoms? This forces them to justify different treatment standards based solely on age. 4. The concern escalation technique state clearly. Doctor, I understand aging affects the body, but this represents a significant change from my baseline. I'm concerned this could indicate an underlying condition. What diagnostic steps can we take to rule out medical causes before attributing this to aging? This next truth is perhaps the most insulting, and I say that because it attacks something precious: your intelligence and your right to understand your own health care. Medical professionals routinely assume cognitive decline in anyone over 65. They simplify treatment explanations, avoid discussing complex therapeutic options, and make medical decisions based on age-related intelligence stereotypes rather than individual assessment. Dr. Jennifer, a neuropsychologist who studies medical bias, shared this shocking revelation with me. Healthcare providers consistently underestimate cognitive abilities in patients over 65. They'll recommend simpler, less effective treatments because they assume seniors can't handle sophisticated medical regimens. Let me share a story. She's a 71-year-old retired chemistry professor who was diagnosed with early-stage breast cancer. Her oncologist immediately recommended a simple mastectomy without discussing reconstruction options, targeted therapies, or clinical trials. When asked about these alternatives, he said, "At your age, we want to keep things straightforward." Had to fight for months to access the same treatment protocols offered to younger women with identical diagnoses. Think about that. A woman with a D in chemistry was told her treatment should be kept simple because of her age. This prejudice shows up in subtle but damaging ways. Doctors speak slower and use elementary vocabulary regardless of your education level. They provide oversimplified explanations, skipping technical details you need to make informed decisions. They choose less effective medications with simpler dosing schedules, believing you can't manage complex regimens. They assume you can't use health monitoring apps, medical portals, or digital communication systems. They make treatment decisions for you rather than with you. Here's what's particularly tragic. After repeated experiences of explanations and dumbed-down treatment options, some seniors begin believing they can't handle complex medical information. This creates actual dependency where none existed before. If you're feeling frustrated or even angry about what we're discussing, that's a healthy response. It means you recognize that you deserve better. Please subscribe to our channel if you haven't already. We're creating a movement of empowered seniors who demand respect and quality care. Your voice matters in this fight. Here's how to immediately shatter these cognitive assumptions. 1. Lead with your credentials. Begin every medical conversation by stating your background. I managed complex projects for 30 years, or I taught high school mathematics for 25 years. Please provide me with detailed medical information so I can make informed decisions. 2. Request technical explanations. Ask directly. Doctor, can you explain the pathophysiology of my condition and how each treatment option addresses the underlying mechanisms? This demonstrates your desire and capacity for sophisticated information. 3. Bring evidence of your engagement. Come prepared with articles you've researched, questions based on medical literature, or notes from other specialists. This tangible proof of engagement forces them to abandon their assumptions. 4. Challenge recommendations. If given basic options, ask, what additional therapies would you recommend if I were 45 with this same condition? I want to understand all available options, regardless of complexity. Use technology proactively during appointments, access health apps, reference digital medical records, or look up medication interactions on your smartphone. When doctors see you're comfortable with technology, it challenges their assumptions about senior capabilities. Now I need to share something that deeply disturbs me, and I want you to prepare yourself because this might be the most shocking truth of all. Medications are often prescribed to seniors not to treat medical conditions, but to control behavior. Psychiatric drugs, sedatives, and mood stabilizers are given not because of diagnosed mental health conditions, but because these medications make patients easier to manage in medical settings and care facilities. Dr. Robert, a former nursing home medical director turned patient advocate, exposed this practice to me. I witnessed countless cases where medications were prescribed not to improve patient health, but to reduce staff workload. Anxious seniors received sedatives, assertive patients got mood stabilizers, and those asking too many questions were given antidepressants. It's chemical restraint disguised as medical care. Listen to these numbers carefully. Over 40% of seniors are prescribed at least one psychiatric medication, but only 12% have diagnosed mental health conditions that actually require pharmaceutical intervention. That means 28% of seniors, more than 1 in 4, are taking psychiatric medications they don't medically need. These drugs often cause dangerous side effects including falls, cognitive impairment, and increased mortality risk. Beverly, a 69-year-old former school principal, experienced this firsthand. After hip surgery, she became frustrated with slow rehabilitation progress and started asking detailed questions about her recovery timeline. The healthcare team labeled her as difficult and prescribed anxiety medication to help her relax. The medication caused confusion and balance problems, leading to a fall that broke her wrist. While her original hip injury healed, the complications from unnecessary medication extended her recovery by 4 months. This medication misuse extends beyond psychiatric drugs. Sleep aids are prescribed for normal age-related sleep pattern changes, not actual sleep disorders. Pain medications are from seniors with legitimate complaints because providers assume drug-seeking behavior. Blood pressure medications are prescribed at doses causing dizziness and fatigue, making seniors less active or assertive. When patients complain about side effects, doctors dismiss them as necessary trade-offs instead of adjusting medications. Perhaps most troubling is how these medications create the very problems they claim to treat. Sedatives cause confusion, then labeled as dementia. Mood stabilizers lead to apathy, diagnosed as depression. Sleep aids disrupt natural sleep cycles, creating real sleep disorders requiring more medications. Healthcare facilities encourage this because medicated patients require less staff time. Insurance companies support it because psychiatric medications are cheaper than proper evaluation. Sometimes families even request it because they can't handle their loved one's natural emotional responses to health challenges. Your protection starts with understanding every medication's purpose. 1. Question every prescription before accepting any prescription. Ask, what specific medical condition does this medication treat? What objective measurements will determine if it's working? How will we know when to discontinue it? 2. Avoid vague prescriptions. Be wary of medications prescribed for anxiety or agitation without clear diagnostic criteria. Many behaviors prompting psychiatric prescriptions can be addressed through environmental changes, therapy, or treating underlying medical conditions. 3. Research. Independently use reliable medical databases to research every medication. Look for side effect profiles, interaction risks, and alternative treatments. 4. Demand specific goals. Say, I want measurable objectives for this medication. If I'm not seeing specific improvements within a set, I want to discontinue it and explore alternatives. Get independent reviews. Request medication reviews with independent pharmacists or geriatric specialists. They can spot unnecessary drugs, dangerous interactions, and opportunities for reducing medications. 6. Document your baseline before starting psychiatric medications. Document your cognitive and physical abilities with assessments, balance tests, and mood evaluations. This baseline helps you spot medication-induced changes. 7. Create a support network. Choose someone who will advocate for you if medications affect your judgment or assertiveness. someone who will question medical decisions and ensure your voice is heard. This final truth is the most heartbreaking, and I want you to sit down if you're not already, because what I'm about to share will likely anger and sadden you. Medical professionals calculate your life value when making treatment recommendations. Behind closed doors, doctors use economic formulas that weigh treatment costs against your remaining quality life years, often resulting in seniors receiving inferior care not because of medical factors, but because of age-based value assessments. Dr. Maria Santos, a medical ethics professor, revealed this shocking reality. Medical training includes concepts like quality-adjusted life years that assign numerical values to different lives. A 70-year-old's remaining years are calculated as less valuable than a 40-year-old's, influencing everything from organ transplant decisions to cancer treatment recommendations. Walter, a 68-year-old retired engineer, experienced this discrimination when diagnosed with kidney failure. He was immediately directed toward palliative care and told dialysis might not be appropriate at his age. Walter had to fight for 3 months to access the same life-saving treatment routinely offered to younger patients. After finally starting dialysis, he returned to full activity levels and lived 7 more productive years. Years he would have lost if he'd accepted the initial age-based recommendation. This valuation system affects treatment decisions in devastating ways. Seniors are expensive procedures and cutting-edge therapies, not because they wouldn't benefit, but because the system has decided their remaining years aren't worth the investment. The same surgery readily offered to younger patients becomes too risky or not cost-effective for seniors with identical health profiles. Expensive diagnostic procedures and preventive screenings are based on actuarial calculations rather than medical need. Mental health treatment receives harsh age-based rationing, with depression and anxiety dismissed as natural responses to aging. Emergency rooms reveal the starkest discrimination. Seniors presenting with identical symptoms receive fewer diagnostic tests, shorter examination times, and quicker discharge decisions compared to younger patients. Emergency physicians privately admit that age influences their clinical decision-making. The economic calculations become particularly cruel during family discussions. Healthcare providers subtly influence families to choose less expensive care options, framing limitations as comfort measures or age-appropriate care. I know this information is difficult to hear, but knowledge gives you power. If this video is opening your eyes to discrimination you've experienced or witnessed, please subscribe and share this with others. Together, we're building a movement that says senior lives have equal value. Your story could save another person's life. Your life has equal value regardless of age, and you must advocate accordingly. 1. The comparison question always ask: would you recommend the same treatment if I were 45? If not, demand medical, not economic, reasons for different recommendations. 2. Research age-specific outcomes. Research treatment outcomes for your specific condition in patients your age. Many seniors have excellent treatment responses that contradict age-based assumptions. Bring this evidence to consultations. 3. Seek multiple opinions, especially from geriatric specialists who understand senior treatment outcomes. Many conditions that prompt comfort care recommendations have effective treatments when managed by age-focused specialists. 4. Use legal advocacy. Age discrimination in healthcare violates federal laws. Legal advocates specializing in senior rights can help you access treatments. Document instances where age appears to influence treatment recommendations. 5. Connect with advocacy organizations. Senior advocacy groups understand system biases and can guide you through appeals processes and alternative treatment options. 6. Refuse age-based limitations. You have the right to refuse age-appropriate limitations on your care. If you want aggressive treatment, comprehensive testing, or cutting-edge therapies, you can demand equal access regardless of age. My dear friends, You now understand the 5 harsh realities about medical ageism that healthcare providers never wanted you to discover. But here's what changes everything. Knowledge is power, and you now possess the tools to transform every medical encounter from passive patient to empowered advocate. Remember Walter, who fought for dialysis and lived 7 productive years that doctors wanted to deny him. Beverly, who overcame medication-induced complications to reclaim her recovery. Carl, whose persistence led to proper treatment for his arthritis. These aren't exceptional cases. They're what happens when seniors refuse to accept discriminatory treatment based on age alone. Every time you challenge age-based assumptions, demand equal treatment, or advocate for comprehensive care, you're not just fighting for yourself. You're changing how the entire healthcare system treats seniors. Your assertiveness creates ripple effects that benefit every older adult who follows. The medical establishment hopes seniors will remain passive, accepting inferior care without question. But you're different now. You recognize the biases, understand the discrimination, and possess strategies to overcome both. I want to make you a promise today. Your health, your dignity, and your remaining years are too valuable to surrender to age-based prejudice. You deserve medical treatment based on your individual health profile, not stereotypes about your age group. Every day, seniors like you are transforming their healthcare experiences using the strategies we've discussed today. They're demanding respect, receiving better care, and living longer, healthier lives as a result. Starting today, I want you to approach every medical appointment with these tools. Be prepared, be assertive, and never accept dismissive treatment based solely on your age. If this video has opened your eyes to discrimination you've experienced, please share it with every senior who deserves better treatment. Your story could save another person's life. Comment below and tell me, have you experienced medical ageism? What will you do differently at your next appointment? Let's support each other in demanding equal health care. Subscribe to our channel right now and hit that notification bell, because every senior deserves dignity, respect, and life-saving medical care regardless of age. Together, we're not just changing healthcare, we're changing lives. Remember, you are worthy of the best care available. You are worthy of respect. You are worthy of being heard. Never let anyone tell you otherwise. Thank you for watching, and remember, your voice matters, your health matters, and your life has immeasurable value.